Healthcare in America faces a crisis unlike any other time in history. We have 47 million uninsured, including millions of children. At the same time, we spend far more money on healthcare than any other industrialized nation. Over 2 million Americans will face bankruptcy this year as a result of their medical bills.
I think when we look at the cost of healthcare that is focused on fixing things when they break, sick care rather than health care, we have a real hypocrisy that arises within our culture.
Despite all of our spending, our health outcomes lag behind other nations. The gap between the health of the rich and the poor is larger than ever before.
While we have made some significant technological advances in the past decade, the health of some of our most vulnerable populations is actually getting worse.
Now is the time to finally keep the promise of affordable, accessible health care for every single American.
I'm Jacob Bryan.
And I'm Adrienne Lewis.
We are students at The Ohio State University College of Medicine. We've seen firsthand that our healthcare system leaves much to be desired. Frankly, many people fall through the cracks.
I remember a 25-year-old man who couldn't afford to take his diabetic medications. He ended up being so sick, we had to put him in the intensive care unit and put him on a ventilator. Stories like these are played out in hospitals across the country every day. 1 in 4 Americans won't have health insurance for at least part of this next year.
It's a common misconception that most of the uninsured don't work or don't have an income. In fact, 4 out of 5 uninsured persons are employed.
Because their employers don't cover health care, their only choice is to buy individual plans, which aren't cheap. In 2006, the average premium for a family was $5,800.
Depending on which state you live in and how old you are, insurance could cost a lot more. And this doesn't even include the cost of deductibles, co-pays, and other out-of-pocket expenses.
While the average American wage rose 20% between 2000 and 2006, the cost of health insurance premiums rose 87%. As a result of these high costs, each year approximately 2 million Americans must come to a building like this one and file for bankruptcy due to high medical costs. 3/4 of these people had health insurance.
We tend to tie health care in this country to employment. It's an accident of history, but nonetheless it is the one that we have, and so we have a confounding circumstance that when people lose their job, they also lose access to health care.
For those lucky enough to have employer-sponsored health insurance, the employer shoulders the burden of the cost. It's very difficult, even for large companies, to provide health insurance for their employees.
And as we move into a globalized economy, it is very difficult for private employers to compete with employers in another country where the cost of health care is being picked up by the government.
GM, for instance, spends more money on health care for its employees than for the steel it uses to make its cars. Between 2000 and 2006, the number of American businesses who offered employer-based care dropped from 69 to 61%.
One of the biggest reasons people are opposed to the government simply stepping in and providing health care for everyone is that it would be too costly and would require raising everyone's taxes.
But wait, our government actually spends as much or more as every country who provides national health care insurance.
While businesses and individual Americans spend a lot on health care, the biggest share of spending is provided by taxpayers through the federal government. Here we can see that the government spends as much money per person as the governments of most other industrialized nations. But our government only provides care for a few select groups of people, like persons over the age of 65, the poor, and the disabled. In contrast, these other governments, like France and Canada, have taken less government money and provided national health care.
Something here just doesn't seem right. In total, our nation spends more than double the amount of money per person as is spent by the average industrialized nation.
We can see that the U.S. is in a spending category all on its own. In 2009, the per-person cost will likely exceed $8,000.
In this video, we will critically examine the American healthcare system. Do we get good value for our money? Are there ways we can reduce costs without diminishing access or quality of care?